Hello everyone, this is Dr. Minister again. Let us do a quick discussion on cryoglobulinemia. So it is the presence of cryoglobulins in the blood which precipitate at the low temperature and dissolve upon the warming. So as the name suggests, cryo means cold, globulins are nothing but immunoglobulins which get precipitate at the low temperature. So what they do is they'll activate the inflammatory cascade by activating the complements and forming the immune complexes which will damage the different tissues in the body. So it primarily affects small and medium sized blood vessels. Coming to the classification, which is given by Bruids. So there are three types based on what type of cryoglobulins we get. So type 1, we get monoclonal immunoglobulins, that is IgM or IgG, and this is associated with monoclonal gammopathies. The examples are multiple myeloma and Waldenstone microglobulinemia. Next is type 2, in which we get mixed monoclonal as well as polyclonal. So monoclonal IgM with polyclonal IgG, and they are commonly associated with hepatitis C virus as well as HIV. Next is type 3. In this we get polyclonal IgM and IgG cryoglobulins, and these are mostly associated with autoimmune disorders like SLE and Sjogren's syndrome. Now coming to the clinical manifestation, most of the patients who are having cryoglobulins doesn't have symptom. If you take 100 patients who are having cryoglobulins in the blood, 50% will be asymptomatic. So the symptoms include, in the skin, patient will have palpable purpura, livido reticularis and ulcers. Renal symptoms like MPGN, that is membranoproliferative glomerulonephritis and proteinuria. Neurological symptoms, in that peripheral neuropathy and mononeuritis multiplex. Systemic symptoms like arthralgia, fatigue, fever and weight loss. Now coming to the diagnosis, laboratory tests like cryoglobulins levels, complement levels, in that we'll see low C4 and C3, hepatitis C testing as it is associated commonly with it, rheumatoid factor, which is often positive in mixed cryoglobulinemia, serum protein electrophoresis to detect monoclonal proteins, that is in multiple myeloma, and next is kidney biopsy, which will show MPGN in renal involvement. Now coming to the management, general measures, we have to avoid the cold exposure because, as I said, the cryoglobulins will get precipitated at cold temperatures. Type specific management, type 1, you have to treat the underlying monoclonal with plasmapheresis for hyperviscosity, and you have to give the chemotherapy for multiple myeloma. Next is type 2 and 3, treat the underlying cause like hepatitis C virus and autoimmune diseases. Severe cases, high dose steroids has to be given. With that, rituximab can be tried, and plasmapheresis, that is plasma exchange. Adjunctive therapy with antivirals and anticoagulation. Now coming to the prognosis, type 1 prognosis depends on the underlying malignancy, but mixed cryoglobulinemia relapses are common in autoimmune associated cases, but treatment improves outcome when the underlying cause is addressed. Thank you.